Hi, my name is Dr. Sapna Kudchadkar. I'm an ICU physician and anesthesiologist at the Johns Hopkins Hospital in Baltimore, Maryland. I am fighting COVID-19 on the front lines in the intensive care unit. I am actually also a COVID-19 survivor. I found out that I tested positive for the disease on March 21st and immediately went into isolation away from my family members to protect them for 14 days. Isolation life was really hard. I initially thought it would not be that hard. I mean, we have all of this technology, Zoom and FaceTime. I would be able to see my family members, but I very much underestimated the value and the importance of human connection by human touch. I missed hugging my family members and cuddling with my kids. And while I was very, very fortunate to have mild disease and did not require hospitalization, that lack of human connection really impacted me during those 2 weeks in isolation. And it really gave me just a tiny, tiny taste of what I think is the hardest part of watching what critically ill patients with COVID-19 are dealing with on a daily basis in the hospital. You know, we can't have visitors at the bedside in order to protect the community, to protect the visitors themselves. And it's really hard because these are patients who come into the hospital and often are on ventilators and wake up and don't remember coming to the hospital. They don't remember what happened to them, and they're trying to make sense of it all. If they survive the disease, and there are many survivors, it is a very long road to recovery. And these patients wake up and the first face they see is an unfamiliar face. They don't see the face of a loved one that they might normally pre the COVID-19 pandemic. They're not hearing the familiar voices that are so necessary to keep them oriented in this very unfamiliar environment. So now it's all of our jobs as healthcare providers to make sure that these patients are experiencing as much of that humanism in medicine that's possible, to be their voice. One of my favorite things to do is to make sure that I know what our patients' favorite things are. I had one patient who really enjoyed watching Gunsmoke, according to his daughter, and luckily my parents also watch Gunsmoke, and he was experiencing some delirium. He was confused after his ICU stay, and I was able to walk into his room and ask him about Gunsmoke, and his eyes just lit up really brightly because it was something familiar, and I was able to refer to his daughter by name and mention this favorite TV show of his, and slowly but surely I started to see this bright light. And for me, optimizing that survivorship, helping these patients on the road to a very, very challenging but really optimistic recovery is what keeps me going day to day in the intensive care unit. So I'm thankful that I had even that small coronavirus experience. Obviously, I cannot say that I share the experience of these critically ill patients and what they're going through, but I definitely understand some of the pieces of the puzzle apart from the life-saving scientific innovations and breakthroughs that are helping us to save patients' lives. We're helping patients get to the point where they can live the best life possible after they leave, and that is really exciting.